just am so glad I discovered the KPMA. The, the quality of the programs is just so good,
Yeah.
you know, so good. And whether it's hearing panels discussing things or it's somebody presenting research, it's like, oh my goodness.
So really our audience is everybody who treats individuals with mental health conditions.
Yes. Um, so when you say that, does that also include primary care physicians then?
Absolutely. So, it's no secret that a great majority of individuals with psychiatric illness really find their first line of treatment through primary care. So KPA is it's the Kentucky Psychiatric Medical Association. So it's a membership-based organization, kind of like any other professional organization. We are under the umbrella of the American Psychiatric Association, or the APA. The folks who have attended traditionally, that's who they've been. They've been psychiatrists, either in practice or in training, and then medical
Mhm.
students who are interested in psychiatry, who are, members of the organization or are going to be members of the organization. However, because we are a statewide organization, our goals and our mission is not specific to medical education and to just the members, because our duty as physicians is to the people.
Mhm.
That really prescribers are that might only be relevant to prescribers on on the surface, but I think that it actually applies to everybody who treats patients with psychiatric illnesses. And the reason being is because when patients have issues with medications, or if the medication is not working appropriately or they have side effects, they might not go to the person who prescribed the medication first. They might go to their therapist first. They might go to their psychologist first. They might go to their PCP first. And
Mhm.
so even the more specific treatment-oriented talks, I think, have that broad applicability to other disciplines.
Yeah, that makes total sense to me. And, I can kind of speak from that side of it. I think that's why I like attending the program so much. Because yes, it is geared toward prescribing and treatment in that way, but that doesn't mean that somebody like me isn't finally the people that I'm working with, they are often already taking some kind of medication, or I'm trying to listen carefully to see, do I think they need that? Because
Yeah.
otherwise, what I'm trying to do is not going to be enough.
Oh, and you bring up some excellent points that I think are worth expanding on. Misinformation is pretty rampant, and so conferences like this provide opportunities for individuals to kind of understand where the current state of affairs is for the
Yeah,
field. So,
yeah.
for example, you mentioned, folks who are anti-drugs. That I think is a misconception over what it is that medications actually do. We treat disorders, we treat illnesses, brain conditions. So it's perfectly reasonable for someone to state that I want to work through a difficult situation without the utility of a medication, but it's not really, might not be wise to say that I want to treat a medical condition by not using a medical treatment. Contextualizing and reorienting the mindset of individuals that provide care, and removing some of those misconceptions becomes quite
Yeah.
important. First and foremost, people are complex. Psychiatric disorders are complex. We treat people and not illness, not just disorders. The other thing is that, it's not our talks, we try to orient them not exclusively to just treatments. So, for example, Dr. Tasman, Alan Tasman is a former chairman of the department. He's a former president of the American Psychiatric Association. He
Mm.
he is the editor of the seminal reference text in psychiatry called Tasman's Psychiatry. So multiple
Yes.
text.
Yes.
And so he is presenting a talk on the social determinants in psychiatry. And in today's world, that's actually very relevant
Okay.
because it informs how all clinicians in this space might navigate the social systems as they treat patients. Another example is, Dr. Wernert, who's, the head of psychiatry for Norton Healthcare. He's doing a talk on the psychology of prescribing. So it's not just about the illnesses and their treatments, but what goes into prescribing itself, what goes into de-prescribing, what are some of the trends and how can we protect ourselves from some inherent biases, et cetera. So that's, I think, going to be a very, very important talk. While we do have a talk on optimizing treatments in severe mental illness and schizophrenia in general, which Dr. Carmen Pinto, a very renowned educator in the state and
Hmm.
regionally and nationally, he's doing a talk on treatment. But our other talks are really geared towards, holistic management of patients, not just the specific pharmacological management of patients.
I'm getting a better understanding of the KPMA in that, yes, it is primarily for the education of prescribers, and way beyond that, for those in the medical field who are adjacent to that in some way. They're either prescribing also, or they're somehow being touched by it.
And so,
Yes.
we are an organization of psychiatrists. That's who our membership is. And our conference, our meeting is specific, on surface to psychiatrists, but realistically, it's applicable to everyone who's in the orbit of the treatment of psychiatric
Yes.
disorders.
Yes. Yeah. Thank you for saying that. That is so helpful to hear. Here I am attending these things, getting great information. So any of the groups you were talking about earlier, I would think other than maybe, the people in my camp, the therapist or whatever, that wouldn't apply to us. But for anybody with an MD, though, they would be able to get
Yes.
CME. Okay,
Yeah, yeah. So
cool.
the CME credits are through the Kentucky Medical Association,
Yes,
which are the Category 1 credits. So yes.
yes.
So what I think is misunderstood is what it is that we actually do. So we are volunteer physicians that are here to serve the psychiatrists of the state and educate the clinicians of the state.
Yeah.
And we do that through educational programming like the conference. We do that through advocacy. We do that through collaborating with other organizations. We do that by working with Frankfurt. And so that's our goal is to advocate for the psychiatrists in the state and then advocate for our patients by educating other professionals in the field, educating ourselves and doing what we need to do to improve the care that people receive.
And I'm kind of like taking off what you just said. And
Got it.
so let's just say there are people out there that didn't realize how much the KPMA has to offer them. How can people learn more about the KPMA and just take advantage of what it's offering or get more involved in some way?
Well, first come to our conference on March 13th in Shelbyville, Kentucky, the Shelbyville Conference Center. So one-day conference. It's we offer CME credits and we have excellent speakers from across the state, really leaders in the field. And then also, visit our website, which is kypsych.org. And our contact information is there, number, email, etc. And you can learn all about us there.
Okay, excellent. It sounds like something I'd want to attend.
I hope so. Yeah,
Yes.
I hope to see you there. So.